So I am Raylan Reynolds. We are with Kentucky Health Corps. I am the success coordinator that helps enroll students in the Lexington and in the Covington area. I will let Megan introduce herself.
Hi, everyone. I'm Megan Eldridge. I'm the Kentucky Health Corps Program Director. So everything day-to-day execution is what I oversee, and I oversee all the coordinators that we have for the program. We administer the program from an organization called Family Scholar House. That's where me and Raylan work. We applied for the grant. It's an Americorp grant. And Americorp is mostly known for doing things in the realm of social justice and education. But when the pandemic came through in 2020, it was evident that there was a workforce shortage happening across the country in healthcare. And so they decided to open up a pool of money for people to create and design Americorp programs across the country. And we specifically focus in Kentucky to raise up the next generation of healthcare workforce. And that looks like a lot of different ways for different programs, but for us specifically, we have partnered with around 35 partner healthcare facilities across the state of Kentucky. And Raylan will give the specifics on which one are in near the Cincinnati area where you all will be interested in the most. But our healthcare facilities, most of them are long-term care focusing on the aging population. And we did just expand into some hospitals. And St. Elizabeth is one of those in northern Kentucky that's close to Cincinnati State, where we're working on a partnership agreement now. And our members perform different roles. We will get into the specifics of the roles available a little bit later, but they go in and perform simple supplementary care to their staff team. So they're there just to really provide a helping hand to the staff team and get hands-on learning experience in the career field that they're interested in.
Yeah, and just to piggyback off that, like Megan mentioned, some of our host site facilities in the northern Kentucky area are St. Charles, Seasons at Alexandria, Madonna Manor. I know that Cincinnati State students are kind of scattered all over, but those are around like 15 minutes from the Clifton campus, I know at least. But I will tell you guys some of the other unique things about our program. Give me 1 second. So we recruit students in a cohort model. So this, you train and work with a cohort from day one. So we really want to recruit a group of students from your school. So you are at that host site and going through this experience with people that you know and other people that you can kind of rely on to have that shared learning experience and lean on them as you go through the program. So you have more than just yourself at that host site. You have really a support system going through the program. Another thing, so we'll get into training a little bit more in depth, but as part of our program, whichever hour commitment you commit to, there is a portion of training allotted for that hour commitment. So I'll give you a better breakdown in a little bit, but that allows you to kind of gain some of those skills and knowledge. So you have that when you are stepping into that role at that host site. Another thing, you'll hear us say living allowance a lot. That is just a specific language that Americorp requires that we use, but basically that is your pay or your wage. Let me skip this over. I'm so sorry. But that living allowance is your pay. You'll see based on the hour commitment, and we'll kind of break down what these 675 and this 450 and 300 hours looks like. But based on which hour you choose to serve, that is your living allowance or your wage over there on the right-hand side. And then another thing that's very specific, this Siegel Education Award. This is basically your, I can't even think of the word now.
Scholarship.
Your scholarship. So Americorp again makes us use this very specific language. You'll hear us say Siegel Education Award, but yeah, like Megan said, that is just your scholarship basically. Once you complete your service term, you'll receive this Siegel Education Award in these amounts that you see here.
Yeah. And I'll say too on that living allowance piece, because When you see your total hours that you commit to for your term of service, we'll set a start and end date for you and break that down into how many hours a week that looks like. And also with that lump, it looks like a lump sum of money attached to that, but really that also gets broken down. And we can tell you that breaks down to basically $12 an hour, and we can share with you each pay period how much you'll be paid. So here are the positions that are available. We have listed the two biggest pools that have the highest demand at our host site facilities. So the first one is this CNA position, and there are slashes with SRNA and medical nurse aide because there's different language used across the state depending on what region you're in. Most people in Kentucky get the state registered nurse assistant, which is that SRNA. A lot of our high school students, we see medical nurse aide, and then a lot of our college students, we see CNA. So either one that you receive will work for performing these duties. If you don't already have that, we will work to help you get it or put you in a position where you don't have to be certified. If you do end up in the CNA role, you can see the specific duties that you will be performing at the site, assisting with preparing residents for mealtime and bringing them to the dining room, assisting in room preparation, bringing pillows, blankets, or any equipment that's needed. And this last one is the biggest one, just assisting staff with monitoring, transferring, and positioning of residents, grooming and bathing residents who have low mobility, and medication distribution. The other biggest demand at the host sites is for dietary aides. Anyone who's interested in culinary or nutrition, this would be a good fit for you. So assisting with meal preparation, dining room service, making sure you're meal prepping and cleaning in the kitchen before and after meals, and then helping just to organize food items and working with your teammates in that way. Some of the positions that aren't listed specifically here because there's a lower demand, but we are looking to still fill these roles. There is social services. So if you are in a social service career path or education path, that would be a good fit for you. We have about 2 requested at each of our partner facilities. Some of them may take a few more. But they work directly with residents to perform things like evaluations on their socioeconomic health and how they're performing at the host site and what they may need to be supported or resources they need to be able to thrive in residency, and maybe a plan of how to move them into thriving. We see that a lot with the social service members who are placed at those facilities. And a lot of times it's often just talking with residents, being that verbal support because they don't have a lot of socialization sometimes with residents who are placed in facilities who don't have family that may be far away, may need a little just socialization, could be a big part of your role in social services. We also have AIT, so that administrator and training role, which requires you to be enrolled in very specific education track. It's pretty business focused. And we also have activities if you're interested in planning and executing activities that the aging population would be interested in. And then, I just lost it, my train of thought. Oh, marketing and graphic design. So if you're interested in any business related field or have a skill set in that, we're also enrolling members in that. It takes a lot to run a healthcare facility. So there are a lot of positions available. And we're definitely willing to talk with you to see kind of what your goals are as far as education and career to see if there's a good fit for you in our program.
Yeah, so here again is that hour commitment, and to give you guys a better idea of what this hour commitment really is and what it breaks down to. So you'll see a QR code at the end of our presentation, And kind of how that will go is that will tell me that you're interested in the program. I'll reach out to you guys and then we can kind of talk through specifically which hour commitment you're interested in and what that looks like each week. So for an example, if you were to enroll in the 450-hour commitment slot, and I think I have another slide that shows this this breakdown specifically. But if you were to enroll in a 450 slot and start in March 14th is our next enrollment period. So each week that would look like about 20 hours a week. And 90 hours of this total 450 would be online modules, like online training that you would complete before you get to your host site. And then that 360, this 360 hours right here is what you would do at your host site. So 90 training hours and 360 service hours on site.
And here is a training breakdown. There's a lot in this. Your training will be based on the role you choose. So some of this may not be applicable, but we like to just kind of give a general overview of the training we have available. The first thing that you'll do is a pre-service orientation with our Kentucky Health Corps staff team after you finish your enrollment steps. So there is an enrollment process. We'll go through eligibility later, but I'm assuming everyone in this conversation at Cincinnati State is 18 or older. So there's a background check that has to be run. There is citizenship verification that has to be made. We make sure that that happens in a particular system. And so there are some things that for timing reasons, you'll want to make sure that you're being proactive about through enrollment so that you can start on time. And that's when you would start orientation with us, is once that entire enrollment process is complete. And Raylan will walk through that with you in your one-on-one and keep you updated on what's next with that. So when you officially start, it is this pre-service orientation will be the first thing you do. We do this over Google Meet. And we make sure everyone is participating and paying attention. We have questions at the end to make sure you understand all of our policies and procedures for the program because you will be expected to follow them throughout your service. The next thing that you'll do is a prohibited activities training. Our state commissioner is called Serve Kentucky. They're the people who keep us in compliance with our grant and give us support on our program. They run a bunch of other Americorp programs throughout the state. We really love them. And they offer this training just so you further understand some of the Americorp language and prohibited activities, which we also go over some of that in orientation, but it's good to have a more in-depth look at that. Everyone in the program is required to go through what's called CDC train modules. The CDC was big in helping develop this grant, and so they had a part in creating some of the training around the program for all public health Americorp programs. And so they are self-paced online modules related to public health, just exposing you to the different career paths that are available to you after you finish your service, kind of helping you explore like what you've wanted to do, what your service is going to look like and where you could end up after, just really giving you a general overview and helping you understand the impact that your service can have in this field. We do have Relias also set up. Some of you may not be actually in that system except for just a little bit, depending on the role you choose. So Relias is an online training platform that's used by a lot of our long-term care facility partners. They use that actually to keep their staff certifications up to date and train their staff annually. So we saw that as a benefit to have in our program, just to have something that's being used in real life facilities. And so we can assign you modules in that system that are also online and self-paced, that are relevant to the work that you're going to be doing on the site to help you feel more confident. This is something we'll also use if you come to us and once you reach the site and you say, look, I'm performing these duties, like I felt really good going in, but I think I might need some additional training on these topics. Can you like help me get some of those training? And we can assign you some modules in this system to help you get trained on the things that you're actually interested in and want to become more skilled at. This CNA class is only relevant to the CNA members who need to be certified. Some of our facilities don't require it, so it just depends on what your goals are and what facility you end up at. But we do have a partnership with UK who has set aside a number of scholarships for our participants in the program. We just have to have a cohort of at least 10 people sign up together in the Covington area to be able to do this as a unit. The next thing is career readiness. So this is something that's not required, but we encourage our members to participate in. At Family Scholar House, we have a career coach who would be happy to set up a one-on-one session with you when you are kind of reaching the end of your service term and looking to figure out how you leverage this experience on your resume, how you talk about it in interviews to make sure that it's helping you stand out when you're in interviews and on your resume. And the last bit of this is just we require all of the host sites to have some type of onboarding and orientation for our members to help acclimate you to their site specifically. 8 is just a general number, but our sites, it's totally up to them what they decide to do with that process. We just require that they have one. So sometimes it could be one day and sometimes it could be a week. Just depends on the site where you end up.
So here is again those hour commitments, but I wanted to point out the living allowance. So depending on the hour commitment that you choose, here's kind of how we do the living allowance breakdown and the education award at the end. So once you complete your whole service term, you will receive that education award as long as you have completed all of your hours and you're in good standing with the program. But for that living allowance, we take that total number and break it up into bi-weekly paychecks. So you will get paid on the 15th and the last day of each month. And it's the same amount. Each paycheck is the same amount no matter how many hours you put in. You just have to put in 16 hours, a minimum of 16 hours each pay period, which when you really think about it, isn't too horrible. That's maybe 8 hours a week. That's definitely doable. But if there is ever say you're going out of town for spring break or something, you just have to make sure you let us know that you'll be gone and you'll still get paid for that week that you're gone. Excuse me. And again, that education award is paid out once you complete your service term. And this can be applied to any higher education office or any bursar's office, just like a scholarship is. So that can pay for books, classes, anything.
Technology.
Yeah. And this is that example schedule I kind of started to talk about earlier. So one thing I don't know if I mentioned the March 14th enrollment date. There are 2 remaining enrollment dates for this program year. March 14th is one of them, and the second is May 16th. Is that correct? May 16th. So like Megan said, if you want to enroll pretty quickly, once we get to the QR code, you can sign up and fill out our application, and I will reach out to you pretty quickly so we can kind of get that enrollment rolling, because it can take a couple weeks to get it going, but if we're quick, we might be able to get you into that March 14th. But here's an example of kind of how it would look if you started on that March 14th date. So you'll go through those online modules, that online training that we've mentioned. From March 14th to April 14th, about a month, 3 weeks to a month, you'll do 3.5 hours a day, 5 days a week is your online training hours. And then you'll start your onboarding at the host site April 14th through the end of our program year, which is July 31st. On here, I think we put July 29th. I think it just falls on like a Friday. But you would do the 24 hours a week at your host site once you complete all of your training. So that gets you to the total of 360 service hours.
And I'll also mention here, I know this is being recorded, so if anyone watching this, this doesn't fit into your summer plans, but you may be interested in the fall, you can still go ahead and apply. Our program year runs from August until the end of July. And so we are recruiting not just for March 14th and the May 16th start dates, but for next program year, we also have fall start dates available in August and October. And so if that's something you're interested in, you'd be able to complete much more hours and do the program for the full year if that's something you're interested in. A lot of times our program does count toward your internship or practicum requirement for your degree. And so that's something to keep in mind. A lot of programs, when you do have to do an internship or practicum, those go unpaid. At least certain opportunities are unpaid. And so if you complete it with us, it will ensure that you get paid for the time that you're completing that for your schoolwork.
So our minimum qualifications, and I won't hit all of these, I'll highlight some of the important ones, but must be a citizen or permanent resident of the United States, must be 17 years of age or older. And I know Megan mentioned, I assume that everyone listening to this is probably 18 or older. So if you're 18 or older, you must consent to and pass a mandatory Americorp and Family Scholar House screening. And that includes National Service Criminal History Check, that NSCHC. You must have a high school diploma. Again, I think that all of you either have a diploma or a GED at this point since you are enrolled in college. Provide verification documents such as a driver's license and social security card. And then 2 that I really like to point out, ability to serve with compassion, integrity, and diligence, and willingness to serve the senior and disabled population. As we mentioned, some of our host sites are those long-term care facilities, so you will be working with that aging population. So just the ability to work with compassion and serve that population. The next 2, ability to perform limited amounts of physical labor, and must have transportation to and from serve site, or your host site as we've been calling it. This is an important one just because some people will enroll in the program, and if we haven't really talked about transportation, they think that either we provide it or maybe it's just not something that they thought about. So just being mindful of if you have transportation of your own, if you'll need to take public transit, anything like that, or even if you need to buddy up with one of your classmates to get to and from your host site.
And then here's the QR code. So if anyone is interested in applying, this QR code will lead you directly to our application or interest form. We use those interchangeably. It's very user-friendly to fill out. And Raylan will see that as soon as it comes through and reach out to you to set up a one-on-one appointment with her.
Good. Well, thank you all so much. I'm going to stop recording, and then if Brianna has any questions, we'll let her ask. So